Few issues in this election are as fundamental, touching every single voter, as health care. And the audience members in our conversations asked a lot of questions about this topic. From Medicare to drug prices, mental health care to medical research. Many of the Democratic candidates had similar philosophies, but there are differences when it comes to strategy for real change.
Medicare for All will provide comprehensive health care to all people without deductibles and without co-payments. And if you think that's too good to be true, that exists in many other countries around the world. Now, one of the reasons that we have not yet done what Canada and other countries have done is the incredible power of the pharmaceutical industry and the insurance companies. All right, you didn't ask me about the cost of prescription drugs. Why do you think we pay twice as much for prescription drugs as do the people of any other country? Because last year, the top 10 drug companies made $69 billion in profit, and 1 out of 5 Americans can't even afford the prescription drugs their doctors prescribe. These are very powerful entities. The insurance companies have unlimited amounts of money as they rip off the American people, and so do the insurance companies. But I think what the American people understand is that health care is a human right, that all people should be able to get the prescription drugs they need without being ripped off. And we're going to take on the drug companies, and we're going to take on the insurance companies. And here on WMUR, you know what you're going to see? A lot of 30-second ads attacking Bernie Sanders as a terrible human being. Because these guys they love the status quo. CEOs get huge compensation packages. These guys make billions. But the time is now to finally say healthcare is a human right. Everybody should be able to get the healthcare they need without those deductibles and without those co-payments.
I believe that we need a new healthcare system. I grew up with a grandmother who had diabetes, and my brother Joaquin and I watched as we got older and she got older. We watched her condition get worse and worse until right before she passed away in early 1996, she had to have one of her feet amputated, which is very common for people with severe diabetes. She had type 2 diabetes. That whole time, though, she had Medicare. I want to strengthen Medicare for the people who are on it, who have it, and then make sure that everybody can have access to Medicare if they want it. As part of that, I believe that we should do things like ensure that the government can negotiate drug prices, right? And that we're able to lower prescription drug costs because of that. There are too many people up here in New Hampshire, for instance, or in my neck of the woods of Texas, up here in New Hampshire who have to go to Canada to get cheaper drugs, or in Texas they go to Mexico. That should never be the case in the United States. And I will support all efforts, all legislation, to ensure that we can bring down that cost. But ultimately, we need to change our healthcare system to one where health care and medication is available to everybody.
Drug pricing is one of the most emotional topics in America, because at some level, drug companies are coming up with things, and they're going to continue to come up with things that are going to save lives and make people be able to live much more healthily while they're alive. And I think we should start by saying part of the genius of America is we are going to solve a lot of things that would have killed us a generation ago. You know, you think about breast cancer. That used to be a death sentence. Leukemia, non-Hodgkin's lymphoma. The American medical research, cohort is doing and has done incredible things for us. And that's part of, the great part of America. But the way it works, I don't know how much you guys know about this, but basically, if you get a new drug that's permitted by the Food and Drug Administration, the FDA, you get a patent on it that only you can make it for 7 years. And you get to charge whatever you want, which if you have a drug that's going to keep people alive, you can charge a lot. We all know that. But at the end of 7 years, the patent's supposed to run out. And that's when the system gets really spooky, and I'll tell you why. They do a bunch of things that, in my mind, the government should never allow them to do. They do a bunch of things to extend that patent for years so that instead of it going from being on patent to become a generic drug that everybody can make, they extend it in a variety of ways, including ways that I consider straightforwardly unethical. And that is where I think we have the problem, because I know that we have to incent people to risk hundreds of millions of dollars to develop that drug in the first place.